Malpractice test for patient care technician updated for 2026 Pass CPCTA Fast. Question 1. A patient care technician observes a nurse administering an influenza vaccine to a patient. The technician should identify that receiving an influenza vaccine breaks which of the following links in the chain of infection? Option A, susceptible host. Option B, portal of entry. Option C, infectious agent. Option D, method of transmission. The correct answer is option A, susceptible host. A, susceptible host. Question 2. Which of the following EKG findings differentiates accelerated idioventricular rhythm from junctional rhythm? Option A, accelerated idioventricular rhythm has P wave. Option B, the ventricular rate in accelerated idioventricular rhythm is slower than junctional rhythm. Option C, junctional rhythm has P waves. Option D, accelerated idioventricular rhythm has wide QRS complexes. The correct answer is option D, accelerated idioventricular rhythm has wide QRS complexes. D, accelerated idioventricular rhythm has wide QRS complexes. Question 3. A PCT has just washed his hands and left the room of a patient when he hears another patient calling for help. The technician notes that the patient calling for help in contact isolation. Which of the following actions should the technician take next? Option A, put on a gown and gloves. Option B, enter the patient's room to provide assistance. Option C, find the technician assigned to the patient. Option D, ask the patient if he needs assistance. The correct answer is option A, put on a gown and gloves. A, put on a gown and gloves. Question 4. A patient care technician is caring for a patient who has a stage 3 pressure ulcer. Which of the following manifestations should the technician expect? Option A, the area forms a blister, and the epidermis peels away or cracks open. Option B, the subcutaneous fat is visible, and there is drainage from the wound. Option C, the area appears as reddened skin that does not return to its initial color after pressure is removed. Option D, the damaged tissue extends all the way through the tissues to the muscle. The correct answer is option B, the subcutaneous fat is visible, and there is drainage from the wound. B, the subcutaneous fat is visible, and there is drainage from the wound. Question 5. A PCT is preparing to care for a patient who has pulmonary tuberculosis. Which of the following pieces of personal protective equipment should the technician put on before entering the patient's room? Option A, N95 respirator. Option B, gown. Option C, face shield. Option D, goggles. The correct answer is option A, N95 respirator. A, N95 respirator. Question 6. Which of the following terms refer to the complete destruction of all forms of microorganisms when providing patient care? Option A, sterilization. Option B, sanitization. Option C, disinfection. Option D, medical asepsis. The correct answer is option A, sterilization. A, sterilization. Question 7. A patient care technician is caring for a patient who is postoperative and has been prescribed incentive spirometry. The technician should recognize that the provider prescribed this therapy for which of the following reasons? Option A, to prevent the loss of muscle mass. Option B, to reduce the risk for blood clots. Option C, to prevent pooling of blood in the lower legs. Option D, to prevent respiratory complications. The correct answer is option D, to prevent respiratory complications. D, to prevent respiratory complications. Question 8. A patient care technician is caring for a patient who is postoperative following abdominal surgery and observes thin, water, reddish drainage on the wound dressing. The technician should identify that which of the following terms is used to describe this type of drainage. Option A, serous. Option B, purulent. Option C, sanguineous. Option D, serosanguineous. The correct answer is option D, serosanguineous. D, serosanguineous. Question 9. A patient care technician is preparing to perform documentation in a patient's electronic health record. Which of the following is an example of appropriate documentation by the technician? Option A, the technician on the previous shift reports giving the patient a bath at 1,600. Option B, the patient has a large, dark bowel movement at 1,100. Option C, the patient will receive an enema at 1,700. Option D, the patient is upset because the nurse from the previous shift forgot to provide breakfast. The correct answer is option B, The patient has a large, dark bowel movement at 1100. B. The patient has a large, dark brown bowel movement at 1100. Question 10. A patient care technician is performing a passive range of motion exercises on a patient's ankle. Which of the following motions should the technician perform? Option A. Circumduction. Option B. Abduction. Option C. Dorsiflexion. Option D. External rotation. The correct answer is option C. Dorsiflexion. C. Dorsiflexion. Question 11. A PCT is reviewing quality improvement tools. Which of the following tools attempts to improve patient safety and the quality of health care by eliminating unnecessary processes and redirecting resources to patients' needs? Option A. Failure modes and effects analysis. Option B. Six Sigma. Option C. Lean methodology. Option D. Root cause analysis. The correct answer is option C. Lean methodology. C. Lean methodology. Question 12. A patient care technician is assisting a patient who is postoperative following abdominal surgery and has a prescription for deep breathing and coughing exercises. Which of the following actions should the technician take? Option A. During the exercises, have the patient place a pillow over the incisional area. Option B. Place the patient in a prone position during the exercises. Option C. During the exercises, have the patient sit with her hands at her side. Option D. Have the patient sit with her head resting on the overbed table during the exercises. The correct answer is option A. During the exercises, have the patient place a pillow over the incisional area. A. During the exercises, have the patient place a pillow over the incisional area. Question 13. A patient care technician has just collected a blood specimen from a patient. For which of the following reasons should the technician invert the collection tubes that contain anticoagulants immediately following a blood collection? Option A. To encourage the mixing of hemoglobin and plasma. Option B. To prevent clotting of the blood. Option C. To prevent blood from mixing with additives. Option D. To encourage sedimentation within the collection tube. The correct answer is option B. To prevent clotting of the blood. B. To prevent clotting of the blood. Question 14. A PCT should identify that which of the following pieces of personal protective equipment PPE should be removed first? Option A. Gloves. Option B. Face shield. Option C. Mask. Option D. Goggles. The correct answer is option A. Gloves. A. Gloves. Question 15. A patient care technician is assisting a nurse to apply a hand-wrist immobility splint for a patient who has left-sided paralysis due to a stroke. The technician should identify that the splint will secure the patient's hand and right in which of the following positions? Option A. Wrist and slight dorsiflexion. Option B. Fingers in an extended position. Option C. Fingers rotated slightly in an external position. Option D. Thumb kept in close proximity to the index finger. The correct answer is option A. Wrist and slight dorsiflexion. A. Wrist and slight dorsiflexion. Question 16. A patient care technician accidentally drops a thermometer and mercury is spilled onto the floor. Which of the following actions should the technician take first? Option A. Mop the floor with a mercury-specific cleanser. Option B. Close the doors to the room. Option C. Evacuate the room. Option D. Dispose of the mercury according to local regulations. The correct answer is option C. Evacuate the room. C. Evacuate the room. Question 17. Which of the following abnormalities is associated with large U waves on the EKG? Option A. Increased sodium level. Option B. Increased potassium level. Option C. Decreased sodium level. Option D. Decreased potassium level. The correct answer is option D. Decreased potassium level. D. Decreased potassium level. Question 18. A patient care technician is transferring a patient from a bed to a wheelchair using a mechanical lift with a sling. As the patient is being transferred, the technician should place him in which of the following position? Option A. Sims. Option B. Fowler's. Option C. Lithotomy. Option D. Trendelenburg. The correct answer is option B. Fowler's. B. Fowler's. Question 19. A patient care technician is preparing to remove a patient's peripheral 4 catheter. Which of the following actions should the technician plan to take? Option A. Don sterile gloves prior to removing the catheter. Option B. Turn the infusion clamp to the on position. Option C. Hold gauze over the site when removing the catheter. Option D, clean the area with saline before removing the catheter. The correct answer is option C, hold gauze over the site when removing the catheter. C, hold gauze over the site when removing the catheter. Question 20. A PCT is caring for a patient who has significant hearing loss. Which of the following actions should the technician take to communicate with the patient? Option A, speak faster than usual when communicating. Option B, use picture board to provide instructions. Option C, speak in a higher tone of voice. Option D, avoid facing the patient when speaking. The correct answer is option B, use picture board to provide instructions. B, use picture board to provide instructions. Question 21. A patient care technician is assisting a patient with bowel elimination. Which of the following actions should the technician take to promote relaxation and emotional support? Option A, check on the patient frequently. Option B, play soft music at the patient's bedside. Option C, place the patient's bed in the supine position. Option D, insist that the patient use a bedpan. The correct answer is option B, play soft music at the patient's bedside. B, play soft music at the patient's bedside. Question 22. A PCT should identify that which of the following terms is used when referring to infections that can be spread to patients. Option A, hospital-attained infections. Option B, healthcare-associated infections. Option C, healthcare worker-acquired infections. Option D, occupational healthcare-acquired infections. The correct answer is option B, healthcare-associated infections. B, healthcare-associated infections. Question 23. A PCT is preparing to ambulate a patient who is at increased risk for falls. The patient asks the technician, "Why do you have to place a belt around me?" Which of the following should the technician make? Option A, a gait belt is used to assist patients out of bed when a mechanical lift is unavailable. Option B, the facility requires a gait belt to be used on all patients. Option C, gait belts are an added safety features when assisting patient to walk. Option D, gait belts are used for patients who are unable to bear weight on both legs. The correct answer is option C, gait belts are an added safety features when assisting patient to walk. C, gait belts are an added safety features when assisting patient to walk. Question 24. A patient care technician recently attended a seminar about hospice care. Which of the following statements by the technician indicates an understanding of hospice care? Option A, the cost of hospice care is reimbursed by Medicare or Medicaid. Option B, many hospice agencies do not require patients to have a primary caregiver. Option C, an immediate family member must accept responsibility for the patient's care. Option D, hospice care covers curative therapies prescribed by the healthcare provider. The correct answer is option A, the cost of hospice care is reimbursed by Medicare or Medicaid. A, the cost of hospice care is reimbursed by Medicare or Medicaid. Question 25. A PCT is preparing to transport a patient via a stretcher. Which of the following actions should the technician take when transferring the patient from a bed to the stretcher? Option A, roll the sheets away from the patient. Option B, remove the patient's fore and indwelling urinary catheter prior to transferring the patient. Option C, instruct the patient to put their hands by their sides. Option D, raise the patient's bed to the same level as the stretcher. The correct answer is option D, raise the patient's bed to the same level as the stretcher. D, raise the patient's bed to the same level as the stretcher. Question 26. A patient care technician is assisting a nurse to perform an aseptic wound dressing change for a patient who has a stage 4 pressure ulcer. Which of the following actions should the technician take? Option A, don new gloves after removing the soiled dressing. Option B, place the new dressing on the patient's wound. Option C, dispose of the soiled dressing in a trash can. Option D, use sterile gloves to remove the soiled dressing. The correct answer is option A, don new gloves after removing the soiled dressing. A, don new gloves after removing the soiled dressing. Question 27. For which of the following procedures should a PCT use sterile technique? Option A, performing a venipuncture. Option B, inserting a straight catheter. Option C, collecting a stool specimen. Option D, discontinuing peripheral 4 access. The correct answer is option B, inserting a straight catheter. B, inserting a straight catheter. Question 28. A patient care technician in a clinic is receiving a urine specimen from a patient who completed a 24 hours urine collection. The technician should ensure that which of the following requirements have been met for the test. Option A. The specimen was allowed to stand for 8 hours following the final collection. Option B. The final voiding of the 24 hours period was discarded. Option C. The patient cleaned the meatus prior to each void. Option D. The specimen was refrigerated prior to being returned. The correct answer is option D. The specimen was refrigerated prior to being returned. D. The specimen was refrigerated prior to being returned. Question 29. A patient care technician should identify that the patient's Bill of Rights guarantees patients which of the following things? Option A. Insurance coverage for healthcare services. Option B. Legal advice for malpractice concerns. Option C. Sharing of healthcare information with their family members. Option D. Involvement in making decisions about their care. The correct answer is option D. Involvement in making decisions about their care. D. Involvement in making decisions about their care. Question 30. Which of the following tasks is within the scope of practice for a patient care technician? Option A. Teaching a new wound care technique to a patient. Option B. Changing a patient wound care dressing. Option C. Providing a patient with medication suggestions to promote wound healing. Option D. Reinforcing teaching about a wound care technique taught to the patient by the nurse. The correct answer is option D. Reinforcing teaching about a wound care technique taught to the patient by the nurse. D. Reinforcing teaching about a wound care technique taught to the patient by the nurse. Question 31. A PCT is reinforcing teaching about using an incentive spirometer with a patient. Which of the following instructions should the technician include? Option A. You should be in the prone position when using the incentive spirometer. Option B. The goal is to get the ball to rise in the chamber of the incentive spirometer. Option C. Blow into the incentive spirometer to make the ball move. Option D. You should use the incentive spirometer every 12 hours. The correct answer is option B. The goal is to get the ball to rise in the chamber of the incentive spirometer. B. The goal is to get the ball to rise in the chamber of the incentive spirometer. Question 32. A patient care technician should recognize that chain of custody is used for which of the following reasons? Option A. To follow methods of collection with samples and data. Option B. To guarantee the identification and integrity of samples. Option C. To ensure that samples are being disposed of using correct operating procedures. Option D. To track the location of samples and data. The correct answer is option B. To guarantee the identification and integrity of samples. B. To guarantee the identification and integrity of samples. Question 33. A patient care technician is performing CPR for an adult patient. Which of the following actions should the technician take? Option A. Check for a pulse at the patient's radial artery site. Option B. Give the patient rescue breaths that have a 3-second duration. Option C. Depress 5 cm, 2 in, into the patient's chest while performing compressions. Option D. Perform 80 to 90 compressions per min. The correct answer is option C. Depress 5 cm, 2 in, into the patient's chest while performing compressions. C. Depress 5 cm, 2 in, into the patient's chest while performing compressions. Question 34. A PCT is caring for a patient who is to undergo an exercise stress test the next morning. The technician should expect the patient to receive which of the following instructions? Option A. Wear tight-fitting clothing on the day of the test. Option B. Eat a light meal 2 hours prior to taking the test. Option C. Avoid caffeine for 3 days prior to taking the test. Option D. Wear an underwire bra on the day of the test. The correct answer is option B. Eat a light meal 2 hours prior to taking the test. B. Eat a light meal 2 hours prior to taking the test. Question 35. A PCT is performing a 12-lead EKG for a patient. In which of the following locations should the technician place the V4 lead? Option A. Fourth intercostal space, to the right of the sternum. Option B. Fourth intercostal space, to the left of the sternum. Option C. Left anterior axillary line. Option D. Fifth intercostal space at the midclavicular line. The correct answer is option D. Fifth intercostal space at the midclavicular line. D. Fifth intercostal space at the midclavicular line. Question 36. A PCT is to collect a 2 hours postprandial glucose by dermal puncture. Upon entering the room, she sees the patient pushing away the overbed table with the lunch trough still on it. Which of the following actions should the technician take? Option A. Ask the patient if he has eaten within the past 2 hours. Option B, mark the test as random instead of 2 hours postprandial. Option C, contact the patient's provider. Option D, perform the test and mark as 2 hours postprandial. The correct answer is option A, ask the patient if he has eaten within the past 2 hours. A, ask the patient if he has eaten within the past 2 hours. Question 37. A PCT in a hospital is preparing to sterilize equipment that was soiled with blood. Which of the following methods should the technician take? Option A, bleach. Option B, dry heat. Option C, boiling water. Option D, autoclave. The correct answer is option D, autoclave. D, autoclave. Question 38. A PCT is transferring a weight-bearing patient from a wheelchair to the bed. Which of the following pieces of equipment should the technician use? Option A, trapeze. Option B, crutches. Option C, gait belt. Option D, slide board. The correct answer is option C, gait belt. C, gait belt. Question 39. A PCT is measuring intake for a patient who has consumed 2 ounces of iced tea, 6 ounces of chicken broth, and 4 ounces of flavored gelatin. Which of the following amounts is the patient's total intake? Option A, 120 ml. Option B, 240 ml. Option C, 360 ml. Option D, 420 ml. The correct answer is option C, 360 ml. C, 360 ml. Question 40. A patient care technician is performing a routine venipuncture for a patient who becomes pallid and diaphoretic. Which of the following conditions is this patient most likely to experience? Option A, syncope. Option B, seizure. Option C, nausea. Option D, shock. The correct answer is option A, syncope. A, syncope. Question 41. A PCT has been monitoring a patient's intake and output for the past 24 hours. Which of the following findings should the technician report to the nurse immediately? Option A, pale, yellow-colored urine. Option B, amber-colored urine. Option C, urine output 1,400 ml. Option D, urine output 500 ml. The correct answer is option D, urine output 500 ml. D, urine output 500 ml. Question 42. A patient care technician is observing a newly hired technician who is disinfecting items. In which of the following situations is the newly hired technician making an object medically aseptic? Option A. The technician uses standard precautions when rinsing a bedpan. Option B. The technician uses soap to clean a resident's bath basin after use. Option C. The technician uses sterile gloves when changing a patient colostoma bag. Option D. The technician uses a chimal cleanser to prepare a should chair for reuse. The correct answer is option D. The technician uses a chimal cleanser to prepare a should chair for reuse. D. The technician uses a chimal cleanser to prepare a should chair for reuse. Question 43. A patient care technician is caring for 4 patients. Which of the following should the technician report to the nurse? Option A. A patient who has a blood glucose level of 190 mg/dl. Option B. A patient who has a blood glucose level of 90 mg/dl. Option C. A patient who has a blood glucose level of 100 mg/dl. Option D. A patient who has a blood glucose level of 130 mg/dl. The correct answer is option A. A patient who has a blood glucose level of 190 mg/dl. A. A patient who has a blood glucose level of 190 mg/dl. Question 44. A PCT is obtaining vital signs for a patient and notices the patient's temperature is higher than normal. Which of the following actions should the technician take? Option A. Apply a cold compress to the patient's head. Option B. Administer acetaminophen to the patient. Option C. Elevate the head of the patient's head. Option D. Notify the nurse about the patient's condition. The correct answer is option D. Notify the nurse about the patient's condition. D. Notify the nurse about the patient's condition. Question 45. A PCT is performing post-mortem care for a patient who is scheduled for an autopsy. Which of the following actions should the technician take? Option A. Remove tubing from the patient's body. Option B. Discard any of the patient's dressings. Option C. Collect the document that patient's valuables. Option D. Remove the patient's dentures. The correct answer is option C. Collect the document that patient's valuables. C. Collect the document that patient's valuables. Question 46. A patient care technician is collecting a blood culture specimen from a patient who has an allergy to shellfish. Which of the following topical antiseptic should the technician use to cleanse the patient's skin prior to the venipuncture? Option A, hydrogen peroxide. Option B, chlorhexidine gluconate. Option C, povidone. Option D, isopropyl alcohol. The correct answer is option B, chlorhexidine gluconate. B, chlorhexidine gluconate. Question 47. A PCT is assisting with the physical examination of an older adult patient. Which of the following statements by the patient indicates a risk factor for elder abuse? Option A, I sometimes forget where I put my cell phone. Option B, I am not able to see quite as well as I used to. Option C, I am able to walk while using a cane. Option D, I live alone, and I don't get many visitors. The correct answer is option D, I live alone, and I don't get many visitors. D, I live alone, and I don't get many visitors. Question 48. A PCT is caring for a patient who is receiving hospice care. The patient states that she wants to stay alive long enough to see her first grandchild, who is due to be born in a few months. Which of the following stages of grief does this statement reflect? Option A, acceptance. Option B, denial. Option C, depression. Option D, bargaining. The correct answer is option D, bargaining. D, bargaining. Question 49. A patient care technician is preparing to clean metal instruments that were used to remove the staples from a patient's surgical wound. Which of the following actions should the technician take to destroy microorganisms and spores on the metal instruments? Option A, rinse the instruments under hot tap water for 30 seconds. Option B, scrub the instruments with a bactericidal solution and let them air dry. Option C, place the instruments in an autoclave and stream them under pressure or moist heat. Option D, soak the instruments in an iodine solution for 30 minutes before singing them with sterile water. The correct answer is option C, place the instruments in an autoclave and stream them under pressure or moist heat. C, place the instruments in an autoclave and stream them under pressure or moist heat. Question 50. Which of the following tubes should be collected first for dermal samples? Option A, lavender top. Option B, green top. Option C, red top. Option D, light blue top. The correct answer is option A, lavender top. A, lavender top. Question 51. A patient care technician is collecting 5 tubes of blood. During which of the following times should the technician release the tourniquet? Option A, after the collection is complete. Option B, while the last tube is filling with blood. Option C, within 1 minute. Option D, within 2 to 3 minutes. The correct answer is option C, within 1 minute. C, within 1 minute. Question 52. A patient care technician is providing postoperative care for a patient who has been prescribed anti-embolism stockings. Which of the following actions should the technician take? Option A, remove the patient's stockings once every 24 hours. Option B, turn the patient's stockings inside out before applying. Option C, ensure that the patient's toes are covered by the stockings. Option D, encourage the patient to partially roll the stockings down at least twice daily. The correct answer is option B, turn the patient's stockings inside out before applying. B, turn the patient's stockings inside out before applying. Question 53. A patient care technician is caring for a patient who has an ileostomy. Which of the following types of stool should the technician expect to observe in the ostomy pouch? Option A, liquid. Option B, black. Option C, foul-smelling. Option D, soft. The correct answer is option A, liquid. A, liquid. Question 54. A patient care technician should identify that which of the following procedures is most commonly used to obtain a routine urinalysis specimen from an adult patient. Option A, clean catch midstream collection. Option B, catheterized collection. Option C, suprapubic aspiration. Option D, 24 hours collectio. The correct answer is option A, clean catch midstream collection. A, clean catch midstream collection. Question 55. A patient care technician should recognize that which of the following is the purpose of CLIA? Option A, to protect patient information. Option B, to establish quality standards for laboratory testing on human specimens. Option C, to provide clinical laboratory education. Option D, to create and promote clinical and laboratory practices. The correct answer is option B, to establish quality standards for laboratory testing on human specimens. B, to establish quality standards for laboratory testing on human specimens. Question 56. Which of the following actions should a patient care technician take when discharging a patient? Option A, review self-care procedures with the patient's family. Option B, inform the patient of any follow-up appointments. Option C, answer any questions regarding medications. Option D, escort the patient using a wheelchair. The correct answer is option D, escort the patient using a wheelchair. D, escort the patient using a wheelchair. Question 57. A PCT is caring for a patient who has a stage 2 pressure ulcer. Which of the following findings should the technician expect? Option A, skin that is intact and non-blanchable. Option B, tissue loss with exposed bone. Option C, visible subcutaneous fat. Option D, blister-like appearance. The correct answer is option D, blister-like appearance. D, blister-like appearance. Question 58. A PCT is caring for a 5-year-old child who reports pain. Which of the following pain scales should the technician use to measure the child's pain? Option A, visual analog. Option B, numerical. Option C, verbal descriptive. Option D, Wong-Baker faces. The correct answer is option D, Wong-Baker faces. D, Wong-Baker faces. Question 59. A PCT must invert anticoagulant tubes to prevent which of the following? Option A, hemolysis. Option B, clotting. Option C, hemoconcentration. Option D, reflux. The correct answer is option B, clotting. B, clotting. Question 60. A PCT is preparing to place electrodes for an EKG on a patient who has large breasts. In which of the following locations should the technician place the electrodes for V4 and V5? Option A, in the closest position to normal, on top of the breast. Option B, in the closest position possible to normal underneath the breast. Option C, on the lateral surface of the breast. Option D, on the medial surface of the breast. The correct answer is option B, in the closest position possible to normal underneath the breast. B, in the closest position possible to normal underneath the breast. Question 61. A patient care technician is preparing a peripheral blood smear on a slide. Which of the following actions should the technician take? Option A, press down on the spreader slide to fix the cells on the lower slide. Option B, apply the spreader slide to the lower slide at a 60-degree angle. Option C, verify that the smear covers about 3/4 of the slide. Option D, apply blood to the clear portion of the slide. The correct answer is option C, verify that the smear covers about 3/4 of the slide. C, verify that the smear covers about 3/4 of the slide. Question 62. A patient care technician is providing palliative care to a patient. The patient's family expresses feelings of anger and hopelessness. Which of the following actions should the technician take? Option A, explain that anger is the first coping mechanism everyone experiences during grief. Option B, refer the family to the charge nurse. Option C, recommend that the patient talk to social services. Option D, listen when the family is ready to talk. The correct answer is option D, listen when the family is ready to talk. D, listen when the family is ready to talk. Question 63. A PCT is caring for a patient whose daughter is visiting. The daughter asks about the health of the patient's roommate. Which of the following statements by the technician is an appropriate response? Option A, I'll get the nurse. Option B, you can ask the patient about his condition. Option C, I'll send a request to the medical records department. Option D, I need you to fax over a written request. The correct answer is option B, you can ask the patient about his condition. B, you can ask the patient about his condition. Question 64. A PCT should identify that which of the following settings adjusts the height of the EKG waveform on the tracing. Option A, gain control. Option B, speed control. Option C, stylus. Option D, lead selector. The correct answer is option A, gain control. A, gain control. Question 65. A patient presents alert and oriented, but a patient care technician finds that all the waveforms are negative in lead eye. The technician should check the cable connections for which of the following limb electrodes? Option A, left leg and right leg. Option B, left arm and left leg. Option C, right arm and left leg. Option D, right arm and left arm. The correct answer is option D, right arm and left arm. D, right arm and left arm. Question 66. A PCT is obtaining a blood specimen from a patient. The technician should identify that which of the following errors could cause specimen hemolysis. Option A, excessively massaging the antecubital space when locating a vein. Option B, failing to release the tourniquet within 1 minute. Option C, redirecting the needle several times to locate a vein. Option D, transporting the tubes horizontally. The correct answer is option D, transporting the tubes horizontally. D, transporting the tubes horizontally. Question 67. A PCT enters the room of a patient who is receiving oxygen and finds the patient's nasal cannula on the floor. Which of the following actions should the technician take? Option A, obtain a new cannula, connect it, and place it on the patient. Option B, clean the cannula with soap and water and assist the patient to put it back on. Option C, check the cannula for damage, and if there is none, place it back on the patient. Option D, check that the cannula's tubing is long enough and assist the patient to put it back on. The correct answer is option A, obtain a new cannula, connect it, and place it on the patient. A, obtain a new cannula, connect it, and place it on the patient. Question 68. A patient care technician is preparing to measure the pulse oximetry of an adult patient who has decreased arterial blood flow. Which of the following locations is the best place to obtain this measurement for a patient who has this condition? Option A, finger. Option B, forehead. Option C, earlobe. Option D, toe. The correct answer is option B, forehead. B, forehead. Question 69. A PCT should identify that which of the following incidents should be reported to the Joint Commission, TJC. Option A, needle stick injury. Option B, sentinel event. Option C, breach of confidentiality. Option D, exposure to blood-borne pathogens. The correct answer is option B, sentinel event. B, sentinel event. Question 70. Which of the following actions is appropriate when labeling specimens? Option A, labeling specimens at the time of collection in front of the patient. Option B, specifying the patient's room number, last name, and date of birth on the label. Option C, keeping the specimens in the tray and labeling them in the laboratory. Option D, writing the technician's initials and the time on the label prior to collection. The correct answer is option A, labeling specimens at the time of collection in front of the patient. A, labeling specimens at the time of collection in front of the patient. Question 71. A patient care technician is caring for a patient who needs to have their urine output measured and record hourly. Which of the following instructions should the technician give to the patient? Option A, leave the urine in the container for me to measure at the end of the shift. Option B, void into the specimen collection device that I have left for you. Option C, clean the perineum with a providine iodine solution before urination. Option D, place the container back into the refrigerator after you have voided. The correct answer is option B, void into the specimen collection device that I have left for you. B, void into the specimen collection device that I have left for you. Question 72. A patient care technician is reinforcing teaching with a patient who has a new prescription for albuterol sulfate to be administered via an inhaler. Which of the following patient statements indicates an understanding of the teaching? Option A, I should place the mouthpiece of the inhaler in my mouth. Option B, I will shake the inhaler well before each use. Option C, I will take the second dose of medication immediately after the first. Option D, I should take a quick, shallow breath while using the inhaler. The correct answer is option B, I will shake the inhaler well before each use. B, I will shake the inhaler well before each use. Question 73. A PCT is caring for a patient who is at risk for pressure ulcers. Which of the following actions should the technician take? Option A, reposition the patient at least every 2 hours. Option B, avoid using powder on the patient's skin. Option C, avoid providing massages for the patient. Option D, place the head of the patient's bed at a 45-degree angle. The correct answer is option A, reposition the patient at least every 2 hours. A, reposition the patient at least every 2 hours. Question 74. A patient has difficulty understanding why she needs an ambulatory monitor after having an EKG 48 hours prior. Which of the following is an appropriate explanation by the patient care technician? Option A, an ambulatory monitor records differently than an EKG. Option B, your doctor wants to study your heart over a longer period of time. Option C, it is standard practice to attach an ambulatory monitor shortly after an EKG. Option D, I cannot discuss why you have to wear an ambulatory monitor. You'll have to discuss that with your doctor. The correct answer is option B, your doctor wants to study your heart over a longer period of time. B, your doctor wants to study your heart over a longer period of time. Question 75. A patient care technician is preparing to transport a patient using a wheelchair. Which of the following actions should the technician take when assisting the patient out of bed? Option A, have the patient push off the bed using his hands when prompted. Option B, place the wheelchair 1 meter 3.3 feet from the patient's bed. Option C, place the wheelchair on the patient's weaker side. Option D, instruct the patient to place his arms around her neck for support. The correct answer is option A, have the patient push off the bed using his hands when prompted. A, have the patient push off the bed using his hands when prompted. Question 76. A PCT is preparing to label a patient's specimen tube following a blood collection. Which of the following actions should the technician take? Option A, face the patient while labeling the specimen tube. Option B, use a pencil to label the specimen. Option C, avoid using computer-generated labels. Option D, initial the label prior to blood collection. The correct answer is option A, face the patient while labeling the specimen tube. A, face the patient while labeling the specimen tube.